A urinary tract infection is one of the most common hospital infections to deal with, and it should be one of the simplest to treat. Often it isn't. The standard move is broad spectrum antibiotics and a wait of 2 or 3 days for a culture to confirm whether that first guess was right. For Mustafa Al-Adhami's grandfather, the wrong antibiotic turned a routine infection into something far worse. So Mustafa went to work. He's the founder and CEO of Aztec Diagnostics, a Y Combinator company whose device identifies the UTI and the antibiotic that will actually treat it directly from a patient sample in about an hour. The science starts with a question most people never ask. Is the bacteria actually breathing? From there, we get into refugee beginnings, a jet ski, a mosquito, and rethinking the way hospitals fight infection. I'm Christopher Wilson. Welcome to Stories in Life Sciences. Let's get into it.
This is Stories in Life Sciences brought to you by MedAxis AI, where we explore how ideas move from discovery to real-world impact.
Welcome to Stories in Life Sciences. I'm excited to dig into this further today. Today I've got Mustafa Al-Adhami. But where are you calling in today from?
Yeah, I'm calling from Annapolis, Maryland. This is the Magathie River.
Okay. On the water there. I like it.
Yeah.
Yeah, last time I was talking to you, I know you had like crabs in the background because I think you were at the office.
I was in the office, but I have crab traps right there. I have a bunch of them.
Are
right
they
off the
actually in
pier.
that water?
Yeah.
Really? Okay.
Yeah.
We have crabs out here on the West Coast, but I didn't realize that it looks like river water. I didn't think crabs were in river.
We have crabs here. The bay is not from here, not far from here, like a couple of minutes away.
Oh, okay. So that's an inlet from
So
the bay.
maybe.
Okay.
Yeah.
Gotcha. That makes more sense. I'm excited to dig into your story and technology today. I forgot in the introduction, but I'll clear that up. But this CEO of Aztec Diagnostics, and we'll dig into a little bit more about just your story and what you're doing, the formation of the company. So let's kind of go ahead and start there.
My name is Mustafa. I'm the CEO of Astek. I have a PhD in mechanical engineering. So the story kind of starts like in 2007. I lost my home and I lost like everything. So I had to become a refugee. I left Iraq. As a refugee, you're not allowed to get a job. So they give you like $500 every 6 months or something just to survive. But then I got a scholarship, DAAD scholarship, like to study in a German school. Once you have that, now you're actually a student, and whatever money they were paying me was just not enough. So I had to find a job on the side, and I found this awesome opportunity where I could take market studies in the Iraqi dialect, and Iraqi dialect is kind of hard to understand. It's very different from standard Arabic. So I would translate it to standard Arabic, and then from standard Arabic, I would translate it to English, and then I give it to someone. That someone will translate it into German. You see how many steps that was?
Whoa.
And they would send me like 17 hours worth of customer interviews like every other day. And it was just ridiculous, taking up my time. So I decided to build a software, and I built a software that like just slowly over time improved and started like understanding the difference between standard Arabic and Iraqi Arabic. So it was like doing it automatically. There was like, we found a software that already existed to do it from standard Arabic to English. Built that software. I was a refugee. I was not even allowed to have a bank account. So they ended up I sold it to a big company, and they ended up sending a nice check to my mom because she had a bank account.
Wow.
Yeah. So that was my ticket to freedom.
Where were you at that point when you were a refugee?
I was a refugee, so I was in Jordan, and then I was in Germany. But that was like my ticket to freedom. It was close to when I was graduating, so I just put whatever I had in a BMW hatchback and traveled until I got robbed, and I decided to use the rest of the money to come to the US and do a PhD. As a PhD student, I was like probably the worst student in the world. I just like I did everything except for being a good student, like doing science and stuff. And around the time I was graduating, so like 6.5 years later, my grandfather had a UTI. And at that point, I thought I wanted to be a professor, so I had a job lined up to teach. Yeah, it was study blood hemodynamics, so the way that blood cells interact with each other and with bacteria. Here's what happened. So he had a UTI. Day one, he just had like a little bit burn when he peed, and that's it. Urine culture was ordered, and they gave him broad spectrum antibiotic, but it was the wrong antibiotic. So day 2, he was in pain, he was delirious, and he fell. Day 4 is when the culture came back telling him that literally it was like all resistant except for one antibiotic that they ended up using with him. But I just watched him go from a young 87-year-old to a much, much older one. I was like, maybe I should do something about it, right? I was like, I was successful once before building a company, maybe I could do it again. Much harder to build a medical device than to build a
Yeah.
software. Yeah, so I came back and I recruited Courtney to the team and I gave her a sketch. Literally, I said, listen, I think this is how it should work. And we still have that sketch on the whiteboard, never erased it. But 5 years later, now we have a fully functional alpha product that is being used in multiple hospitals. That's where we are right now.
Yes, talk more about that because currently that's the problem I see as well, is that it takes a long time to get the diagnostic back. So you kind of solved that aspect of the problem. But then the other thing is the antimicrobial resistance is another
Yeah,
huge issue as well, is
right.
that they're, yeah, essentially now just talk more about like the current status and the problem and
Yeah,
how you're
so
uniquely addressing it.
right. So right now, if someone has a like suspected to have a UTI, what they do is there's a urine cup. You take a little bit of that urine, you test it in your analysis to make sure there is a UTI. The analysis like measure like white blood cells. So like there could be a million reasons that you might have elevated white blood cells. So it's not, so 50% of the time it's actually a false positive. So that's very quickly, and then they start with broad spectrum antibiotic. These are antibiotics that will hopefully work, and then they send out a culture. The culture comes back a couple of days later, ideally confirming the antibiotic you gave, or or you have to change the antibiotic. So that's the problem right now. And if you had given the wrong antibiotic, and if the patient is healthy, that's cool, right? Like they're fine. You just change the antibiotic. But so many times, what you have to do is like you have to address all the complications that happen. And the worst complication would be sepsis, and 25% of sepsis cases originate as UTIs that were not treated properly. Our device can tell whether there is a UTI and what antibiotic to treat this UTI with directly from patient sample in 1 hour. You don't have to guess what antibiotic to give. You're just going to give them the proper antibiotic right away.
Yeah, this is such a huge shift in what's happening right now, like in a hospital environment. For those people who haven't been in there to see, how this could change from a timing perspective, but yeah, also the correct antimicrobial. Because right now, like you said, like with your grandfather, they're essentially, I feel like it's like carpet bombing, like just putting in a broad spectrum antibiotic and hoping that it works.
Yeah,
And then
yeah,
afterwards, seeing that actually it may have caused more harm than good.
absolutely, absolutely. We talk to so many patients, and some of them get Cipro, and it's a very strong antibiotic, and would land them in bed for like 3 days because of the side effects, and because like it's destroying their microbiome, etc. Like you mentioned, there's a shift, right? And shifts are hard to come by. And that's why when we're trying to tell people about our device, we're thinking about when you have a sore throat and you get a strep test. Very, very quickly, they tell you if you have strep throat, they give you the antibiotic, but they still send the culture, right, to confirm. What we're saying here is send out the culture because you need that information. However, treat us like the strep test. We're giving you information that there is definitely a UTI, and we have 97% specificity, and we're telling you what antibiotic the patient should be treated with, and we have about 93% accuracy. Cultures are important. We're not trying to replace them.
I want to talk more because this was fascinating to me, like how it actually works, like what your device does, how it actually shows that activity, what it's reading, that both shows one, I guess, if they have an UTI, and then
Yeah,
how it actually then shows which antibiotics in particular can work.
it was a typical case of an engineer trying to pretend to be a biologist. So I was like, yeah, so like, well, a human is alive if they're breathing, right? So why can't we do the same thing with bacteria? So if the bacteria is breathing, it's there. If the bacteria is dead, well, it's going to stop breathing. So there's not going to be oxygen consumption, right? To translate that into real science, when bacteria is metabolizing, it produces NADH. And if there is NADH in the sample, that means there's bacteria.
Yeah.
NADH reacts with a dye or reduces a dye called resazurin. Resazurin is a blue dye, but in the presence of NADH, it changes to another form called resarufin. Resarufin is very pink. Resazurin is very blue. Pink fluoresces more than blue. We detect the fluorescence change. Simple as that. So you add different antibiotics, you see which one is diminishing the production of NADH. That is the one that is killing the bacteria. When the bacteria stops breathing, using oxygen, reducing the dye, it's dead.
It's super complex in some ways, but it has some simplicity to it as well as being
Yeah,
able to just see it's breathing. Okay, there's bacteria. Does
cool.
this does this antibiotic work? Does it diminish that? You can see it.
Absolutely. It's
right?
very, very simple. All you need is a couple lasers, a couple photo detectors, and some pumps.
How does it fold into like the hospital workflow, or do you seen that? Because from an adoption perspective, I think that's so important.
Like in a hospital, right? You have your analysis. You're already doing something like that. There are two settings within a hospital that we're going after. In the beginning, our first rollout is going to be at a hospital lab because we're going de novo and we cannot get a CLIA waiver right away. So when it's there, literally, like you're doing the culture, do our test right next to it, and the data is going to be in the patient records very, very like within an hour. Now, once we have the de novo and we have some data, the idea is to get a 510K plus a CLIA waiver using the de novo. So this is for every population that we have to do that, unfortunately. At that point, it could be patient side, could be at a clinic, could be anywhere. It could be treated just like your analysis. CLIA waived, could be used by anyone.
I feel like another important aspect of yours, and we talked about this last time we spoke, is that you don't have to test it right away. Because in a hospital,
Yeah.
sometimes that is a challenge to just, maybe somebody had something overnight and staff changes, things change. Like, how does that work? Why can yours, 6 hours later, where other ones you have to test it right away?
The way I look at it is there's a competitor out there in the market, and you have to test right away because they are looking at cell division. And if the bacteria is dividing, that means like it's alive, right? It's dividing,
Uh,
it's thriving. And there are different antibiotics going to stop dividing. But for a cell to divide, it has to be thriving. It has to be in like the log phase and really, really happy. In our case, bacteria will metabolize. Even if you put it in minus 80, the metabolic activity is going to slow down so much, but it's still going to be metabolizing. And as long as it's metabolizing, there is an ADH. Full disclosure, we've tested up to 12 hours. We have not gone over 12 hours, but this has been simulated in multiple clinics. It's never more than 12 hours until the test happened.
wow. 12, I feel like 12 hours is enough. I mean,
I would
that's,
say that. I would say that. I
yeah.
would say that's like because like if you're letting it sit for 12 hours, why even buy our test? Just
Yeah. Like,
right? This
I
is
mean, there's other
nonsense.
problems in the hospital. I feel like if they're longer than 12 hours, it's not your,
Absolutely.
it's like,
Absolutely.
this is kind of an urgent matter to be able to know. But I just feel like
Yeah.
having beyond maybe a 1 hour window is helpful. Like knowing what hospitals can be like, what workflow, having that
Yeah.
longer window is a benefit. But to your point, do you really need longer than 12 hours? Hopefully never. Like,
Yeah,
yeah.
absolutely. And like again, that same competitor, and I like their technology. It's cool, but like you have to test within 20 minutes. I mean, with an enlarged prostate, it might take you 5 minutes just to pee. So like it's hard to do. Like yeah,
It's hard to do that, especially in that environment all the time. Like,
absolutely, absolutely.
yeah,
It's
if
hard to predict. It's hard to predict.
hard to predict. And then talk more about the regulatory pathway. Why de novo for you?
Well, no one has ever done what we're doing. There's no predicate device. We met with the FDA and they were like, you should go to Novo. Yeah, we learned a lot in that meeting. For example, like indication for use, someone has UTI, use our device. Apparently, it's more complicated than that. Like you have
Yeah,
to,
it is.
like, yeah, we like grouped all of the patients all together. It's like, oh, you have UTI? Yeah, I got you. No, you have to pick a patient segment and you have to go after
Yeah.
that one segment. There's no predicate, so de novo, the patient segment has to balance risk reward and certainty that your device actually helped the treatment of the patient. Toughest patient population in UTI is patients with neurogenic bladder syndrome, and they need us the most. And I feel like the risk reward was just so high that we decided that is our beachhead. De novo to get to that population. Now, after the de novo, the plan is to go for a 510K CLIA waiver, and this time we're going after urology clinics. For urologists, one, they see the more complex cases, right? Because you must have been feeling bad to go to a urologist. And two, they used to use multiplexed PCR. Multiplexed PCR used to be reimbursed like $1,200, $1,500, and they started running these for everybody because it would cost them like $200 to run it. You're getting $1,500 of reimbursement. You're making so much money out of these tests. So CMS were like, all right, hold on, we're pulling
Usually
that.
how it works.
Yeah,
Those
like
don't
you
last.
need
Those always last for too long.
exactly. So a void became very clear to us in that specific market. So the idea for us is to swoop in and fill that void. What we did was like we went around and asked people to sign contracts like LOIs. The LOIs say like once these guys get FDA clearance and CLIA waiver, we'll buy their test. We've never had one meeting with a urologist that did not sign that LOI because of the need right now for a solution.
Wow, that's exciting market research for you.
Absolutely. I did that. Remember, like in the beginning, that's why I started there. I used to translate these interviews, but I learned so much. So
Yeah. So what's next? Like, where are you at now
yeah,
specifically? And
yeah. So when we started, I defined success as we treat one patient with recommendation of our device and change what however they were going to be treated to the proper way. And we are hitting that milestone next quarter. Two devices will be deployed to treat 150 patients with neurogenic bladder. For the first time, the results from our test will be actually used in the treatment. That's really cool.
that
And
is cool.
yeah, yeah, so that actually is a grant that we got from the Nielsen Foundation. So their funding is 100%. There's a grant called Caribou. I don't know what that is, but they gave us money to
You don't know
yeah.
what it is, but they gave you money. I wish everybody would be happy with
Well,
that.
I listen. I am so lucky that I have a great team that I don't have to like double check their work. I don't have to like question them. So when my CSO was like, "Say, hey, by the way, we just got money from Caribou," I was like, "Heck yeah, dude! That's my
Got it.
contribution. Like, I'm just a cheerleader." But yeah, so we got that money, and now we're gonna try our test with women postmenopause, and we just made a deal with George Washington University to do that. All of that uses the alpha product, but alpha feasibility is done. So this is just more data. We need to go to beta. Beta is the one that we enter the market with. So the alpha works exactly like the final product, but it does not interact like the final product. It's not documented. Was not under design controls. We had to save money any way we could just to get that done. So we're raising now money to get the beta built and do the clinical trials and submit to the FDA. So we're raising $15 million to accomplish all of that. I'm happy to dig more into the raise and some of the investors that already committed.
I'd like to talk a little about your team. Yeah, and just what you've learned from that too over time,
Like
because that's
like
a
like how I built the team.
yeah, how you built the team.
Employee number one, for lack of a better term, I slid in her DM. I needed someone to help me, and I needed someone like very quick. I had just finished a PhD, never really had like corporate job to know how to hire, but I had LinkedIn and I post things on LinkedIn so people add me, and I looked through my connections and I found three chemical engineers in my connections that were like either students or like recent grads or something. One of them was Biotrack, so I sent her a DM saying, "Yo, you want a job?" Question mark.
No,
And
serious?
I swear I could show you. Uh, and took her 2 days to respond because she was trying to make sure this was not some kind of scam. Because like
Yeah.
so now it's like what 5 years later. She told me like she called her dad. She's like, "Hey, I need a job, and this guy just sent me this. This is serious." And he was like, "Yeah, just respond and see what happens." So
Yeah.
she became our first hire. Yeah, and she's a
Did you
rock
even have
star.
like a company started at that point or
No,
anything?
no, no, no. This was like a month before incorporation. But anyway, so she became our first hire. She really did a good job. She's doing a good job. She's now Forbes 30 under 30. Like she really
Whoa.
like the way I hired her was like so weird, but it worked out. My second hire was Chris. Again, I didn't know what I'm doing, so I got in touch with a local blogger and I said, "Hey, can you post this?" He said, "Yeah, it would cost you 250." I said, "I don't have money." He did it anyway. And man, we found the smartest guy in the world. His name is Chris Skipwith. He went to UPenn. He had like all these, very, very fancy jobs. And for some reason, he decided to like quit it all and join us. And it was like the best thing ever. And he's the one that writes our grants, by the way.
Ah.
Yeah, so that's why I don't question him because like he was way smarter than me. Everyone else was like, word of mouth. But the first two hires were like a little bit different, and then word of mouth.
Well, that's a good sign. I feel like that's when you know you're going the right direction when you get people like that. Yeah.
Man, I'm so lucky. I am so lucky to have these guys. Yeah.
You must have came up with a pretty compelling idea and your conversations with them. How were those conversations with them? I guess I'm curious, like, because yeah, you sent a DM, but then you had to talk to them. And if that didn't go well, then I assume they wouldn't be there. So I mean, you must be passionate about how did you pitch them on coming to work with you, especially when you don't even have a formation yet? Like, how do you tell someone, you know,
Well, I think you need a podcast with my first hire. You need to interview her because
okay.
you know what we talked about for 45 minutes?
Hmm.
Netflix shows. And then like towards the end, and I said, can you send me like something that you wrote and you're proud of? So she sent me something, and I liked her writing. I think if you can write well, that means you can think well. Then the writing just told me everything. Like, I don't like when people put candidates through like 7-step interview.
No, I like that. Well, anything that you would tell people that are building a team, like things that you learned, or would you do differently? Or
As far as team,
yeah,
honestly, like if you have a good feeling about someone, that's the right person. Anyone can like BS for length of the interview, right? Like, but if you have a
yeah,
gut feeling about someone, just hire them.
I like that. Yeah,
Yeah,
it can be pretty simple. Yeah, and the nice part is about a smaller company. I worked for large medical device companies. It's not always much of an option because there's a set process. But yeah, trust
yeah.
yourself. I think that's
Trust
what you're
yourself. Trust
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 yourself.
yourself. Actually, our most recent hire, and you can go through my LinkedIn and see it. It was not long ago. I need someone smart to hire, and like I got like 30 resumes. Each one like is a different specialties, and like all kinds of people were like reaching out to me. I was talking about it like a business intern just to help me with like creating the database for Series A, finalizing data room, stuff like that. I ended up hiring a PhD from I think she went to North Carolina, like super smart woman, and she ended up becoming one of our like main scientists. You never know, just
Yeah.
yeah. I mean, I'm not encouraging people to hire like I do, but really, I I
Yo, you
I
want a job? You're not saying
yeah,
that that's like the
yeah,
main
yo, you're
way.
looking for a job. Yeah,
But I
you
do
should,
like it that it's just trust yourself. I do like the
yeah,
writing part too. That's something that's
yeah,
interesting. Yeah, if you trust their writing, see something that they created, get an example of what they created. Yeah, because people can't
yeah.
make that up. Although now you can tell. Well, somebody could do with Claude, but you could tell. You could tell. So
You can tell. I don't look for the candidates, but I sometimes interview the candidates. Like we have three of us on the call, and I never ask like questions like about our work. I just like give them some riddles, and based on how they react, like whether they ask follow-up questions, or like if I'm telling them something with numbers and stuff, if they like grab pen and paper, stuff like that is what I'm looking for them to do, because in the end no one knows everything, and you have to learn, you have to ask questions, you have to follow up, especially with interns. I mean, they hate when I interview people because it's weird, but really, like, we learned so much about these guys just by putting them in uncomfortable situations.
yeah, I feel like it's really the only way. Like I've interviewed so many people and just having that blanket checklist thing. What do you know? Everybody can
It's so
prepare for
stupid.
that. Like I
Yeah,
never understood it. Like hiring so many salespeople or building teams, it's like get some real stuff. Ask them some real questions. Like put them in some uncomfortable
absolutely,
situations. Like
absolutely,
otherwise,
absolutely.
yeah, yeah, that's great. And then yeah, you talked about raising money. What's next in that process for you?
Luckily, we've raised enough to hit our next milestone, so that's really good. We have about 15-month runway, so this is amazing for us. And then now we're looking for the Series A. We have so many smaller investors that committed, but we need that lead. We're working with a couple of leads to finalize things, get a term sheet. So if any of your listeners is interested in what we're building and would like to talk, I'm happy to give them the opportunity to invest.
Perfect. No, I think, and then you talked about there's the now and you kind of your beachhead, which totally makes sense. Like focus on the de novo. That's the pathway to market. But where do you see? Because I just see so many applications for this technology outside of just
Yeah,
UTI. I
yeah.
mean, what it can do. Like, what do you see the long term vision of what you're building and creating?
Blood is a little bit more complex because we need to get rid of the red blood cells before we could run the test because it would interfere. And yeah, it was really hard. It was my job at the beginning to figure out how to fish out 10 colonies of bacteria that was floating in like billions of billions of blood cells, right? Like, sounds really hard. One day I was like, you know what? I need to go on vacation. I went and I got on a jet ski for the first time, and I
Nice.
was going through like a no wake zone, and I got attacked by mosquitoes. I'm saying hundreds of these things, and they bit me like top to bottom, and I hated my life. So anyway, there are two lessons two lessons from that day. The first one is I belong indoor. I don't know what I was doing outside. The second lesson was the second lesson was, and I learned that through research. I was like, why me? Like, I was not the only one on the jet ski that day, but they attacked me. And that took me through like some rabbit holes of trying to understand, like, why did these mosquitoes leave everyone and attack me? after some time of research, I learned that what mosquitoes do is they suck out your blood, they digest the red blood cells, and they pee out the plasma.
They pee out
Because
plasma. I didn't know that part.
yeah, so that's why like
Interesting.
right after you get bit by a mosquito, look at the spot and see the sparkle. You'll see the
Whoa.
sparkle.
Okay.
Anyway, that kind of like it was like an aha moment for me. All I need to do is build the mosquito on a microfluidic chip because the plasma would contain the bacteria because of the density difference.
Whoa.
So that is how we do it. We have a little device called a mosquito that would be added to the current cartridge so we could get the bacteria out of the helmet.
So you're the only person that doesn't smile riding a jet ski, but it did lead to a pretty amazing breakthrough for your
Yeah,
technology.
absolutely, absolutely.
That is so cool. Well, that's what excites me. I mean, not just about what you're doing with UTI is just a platform really to help, antimicrobial resistance is such a huge issue in hospitals. A lot of my early time, as I told you, spent with antimicrobial catheters and Teleflex and different resistance. And it's a huge issue still to this day. We're kind of doing things an old way. So I feel like what you're doing has widespread application. That's exciting to see where it goes beyond just, I mean, the UTI is obviously an important aspect.
Yeah, absolutely, absolutely. And also like what you and I are like talking right now about the diagnostic side, right? It's so 2015 the way we're looking at it. But if you're thinking about, we're getting three pieces of information very early on that we never had before. So what else could that unlock? Because you already have some information about the patient, like demographics and history and whatever. Now we're adding three things very, very quickly. The big question now that I keep thinking about is we have a software that goes with the Jiddu, and it's a blank canvas with all this cool stuff that has happened in technology. Like, what can we predict? What can we help with? What could this do for patients and for hospitals? And this is the part that's exciting me so much.
Yeah.
And there's an app actually that we are commercializing. It's available now. It's called Bladder IQ, and it's based on 10 years of research by Dr. Suzanne Rose. Like, it tells people like can predict UTI for neurogenic bladder patients from basic symptoms. Like, imagine that, but now you have on top of it the results from Jiddu. What could it tell us? This is what I'm excited to see. And if someone is listening here and have ideas and they want to like collaborate, they should just get in touch with me.
No, that's what got me excited too. I told you I put some of your stuff into a notebook LLM and listened to a podcast on it,
Right.
and the platform of what you're doing. It's just I mean, I had our first conversation, then I listened to that, and I'm going, whoa,
Yeah.
this has a lot more like application out there.
Exactly. And this is the exciting part, right? Like, what else can
Yeah,
we do with that information?
yeah. What else? And then you touched on this, but we haven't talked about it. But you said the name Jiddu.
Jiddu, yeah, you got it.
Yeah, yeah. And what is that? What is that? And where did that come from?
Oh, so I told you like the reason we started companies is because my grandfather had a UTI,
Yeah.
and my whole life I've called my grandfather Jiddu. It means grandfather in Arabic. Like Jid is grandfather, so Jiddu is like the cute way to say it. So this is what I've called him my whole life. So I named the device after him. And I think that's pretty cool. Except that my grandmother was very jealous. So now there is a spice in the market named BB, which is what we call her. So that was my brother's product. So now they
Nice.
both have products. Yeah,
Yeah, I think the personalized thing is important. You mentioned some other like a part
yeah,
that I think was personalized when we talked last time that
yeah,
you have in the technology what you have tell more about you have people's like pets in there
yeah,
like
yeah. So like I wanted this to be personal to everyone on the team, right? Like, because I don't pay them well, so
you put that in your LinkedIn messages.
no, that comes later if someone cares enough to listen to me around 40 minutes later, they're gonna learn that I don't pay much. But anyway, I was like, let's do the same thing. I was like, hey, Courtney, you love your dog. What if I sketched your dog on the PCB? So I sketched the dog on a piece of paper and we handed it over to the PCB manufacturer. Now it's on and now we have multiple like pets on the PCB. So in the end, my grandfather, all these pets are immortalized through our invention. Every time you open one of these digital product, you'll see dogs and a cat. And
Yeah, that's pretty cool. Yeah,
yeah,
it's personal for you, but you made it personal for everybody. Yeah.
it's personal for everyone. It's personal for everyone. It's a hard job. Listen, like this is
Yeah.
such a tough job.
Well, it seems like, yeah, you've created something pretty special, and excited to see kind of where that goes next for you. And you've talked about this, but raising money for the next round, and when they're trying to close that by the end of the year, and then de novo
Yeah.
pathway later this year as well.
Later next year.
Later
Late
next
next
year.
year as de novo. Yeah. We're raising 15 million, close end of this year. We're on track. We're actually ahead of schedule, and that will get us to the market. That's going to get us there. And we have letters of intent for like $30 million. So we have the pipeline. We just need to arrive to that point where we could fulfill all these contracts.
Any advice that you have for people with an idea like you, early stage founders that are see a problem and want to bring it to market, the commercialization aspect? Because as we've talked about, and people that are in this space now, it is not easy. It's not easy. Like and not that what you did before wasn't easy, like developing that software, but
Yeah.
I'm sure like medical device diagnostics is a little different. So
Two things: if the problem's not keeping you up at night, maybe it's not worth pursuing.
yes.
My second best advice is there's a singer called Pitbull. Have you heard of him?
Yeah, I've heard of Pitbull. Yeah,
Yeah, you
I
know what he
like some of his
says.
jams.
Yeah,
Yeah.
ask for money, you get advice. Ask for
Ask for
advice,
money.
you get money twice.
Yeah,
You
money
cannot
twice. Yeah.
you cannot misquote Pitbull. That's not me. I'm not taking credit. It's Pitbull. So what you do is you go around when you don't need money, ask for advice from people that might invest in the future multiple times. This is the secret for fundraising.
I haven't heard. I like that one. I haven't heard that. Like other one you said is so important though too. I mean, that sounds like I was at a Tony Robbins thing, and he says, if your why doesn't make you cry, then it's not your why. You know.
Yeah, yeah.
And you brought it
Yeah.
up, like if your why doesn't keep you up at night, then you should be working on something else, because
Some
this is a long
something else.
road. And if that doesn't, and it sounds like this one definitely keeps you up at night, and it still keeps you up at night, but in a good way. Like you finding
Yeah.
different ways to think about what else could you do? What else could you
Abs-
create?
Absolutely. I posted on LinkedIn that it's one of my babies. I have 2 kids, and then so like I have 3 kids, and they grow up so fast. Aztec is 5 years old as of May 27th. So
Well, I'm excited. I really appreciate your time today, Mustafa, and I'm excited to see where this technology goes. Like you're really solving like a real problem. I mean, I've witnessed it in hospitals, and yeah, this the ability to rapidly shift and change that and create a platform. And the antimicrobial resistance piece too is such a huge issue. I feel like you're hitting multiple pieces of a problem in a new way.
absolutely,
Yeah, yeah.
absolutely. I mean, listen, it's a huge problem that we're working on, and we love the process. We're enjoying the process. And 2028 will be in the market.
I love the interesting story and the pathway. Yeah, it's not a traditional way, and
Yeah, yeah.
not an easy path that you've taken to get where you're at now. So I put money on it. You're solving a good problem, and you're gonna make it. So
All right,
yeah.
I'll send you a safe note after the call.
Sounds good. And I'll put it out there to anybody else out there too. This is a problem, and I feel like you're uniquely positioned to be able to solve that problem. And then where can people find you? I feel like you said you're active on LinkedIn, and
Yeah, I'm very active on LinkedIn. Mustafa Al-Adhami.
thanks so much for your time today, man. Yeah, I love those stories, man. Just like how something came to mind. I mean, that's awesome. So thanks for sharing that, man. Yeah.
It's the ADHD.
Yeah, but I feel like once you get, I mean, that's how my mind works a little bit too. Once you get kind of obsessed with with something, then
Yeah.
you find these new ways. Oh, what else could it do?
Absolutely.
Oh, how else
Absolutely.
could I use this? Like, oh, and that's fun too. So
Absolutely.
yeah.
Yeah.
Okay. Thanks, Mustafa. Have a great rest of your day. Look forward to staying in
Th-
touch.
Thank you. You
All
too.
right, bye. You've been listening to Stories in Life Sciences, sponsored by MedAxis AI, where we explore the people, ideas, and breakthroughs shaping the future of biotech and healthcare innovation. To learn more, visit medaxisai.org and subscribe on YouTube to watch the full conversations and new episodes as they launch. I'm Christopher Wilson. Thanks for joining us. Until next time, keep shaping the future, one story at a time.